Let's discuss hormones, obesity, and GLP1 medications and how they can all be interrelated. I'm Dr. Krista Gonzalez, and I am an endocrinologist as well as an obesity medicine specialist. And I love this topic because as an endocrinologist, I'm actually used to being asked, how are my hormones affecting my weight? Well, now the question seems to be switched around as more people are being successful in their weight loss journey and on GLP-1 medication. Now the question seems to be, how can my weight loss journey affect my hormones? This is a 3-part series. I'm going to be discussing in this first part the effects of GLP-1 medications, or actually weight loss, on testosterone in men, as well as estrogen effects or estradiol in men. A couple of things are well known in the endocrine world. One is that you can actually be misdiagnosed with low testosterone or low T if you do happen to have obesity, because it does affect the way we read the labs when we do a workup or check your total testosterone. On the other end of the spectrum, it's also well known that severe obesity can lead to functional, or what we call secondary, low testosterone levels. And other related conditions like sleep apnea, for example, can also lead to low testosterone. This is not medical advice. It's really important to get a full and complete workup whenever getting screened for low testosterone. And that's really important to keep in mind because it does affect the way things are treated moving forward, as well as the cause. So obesity, along with other conditions like diabetes, as well as kidney disease or chronic kidney disease, are pro-inflammatory states, which can actually affect the way your brain communicates with hormone signaling to the testicles, and ultimately affect how much testosterone is secreted. The takeaway here is to treat the underlying cause. In other words, weight loss can decrease adipocytes or fat cells. And by decreasing these fat cells, you can actually decrease the amount of testosterone that's converted to estradiol. About 80% of your estradiol in a man, it comes from this conversion of testosterone to the estradiol from the fat cells or the adipocytes. It is well known that estradiol does increase significantly in men as they go above their ideal body weights. As this is happening, the estradiol is going up and the testosterone levels can come down, and then your ratio of testosterone to estrogen shifts. There are other pro-inflammatory effects that are happening as a result of increased adiposity, but this is the direct effect of testosterone and estradiol changes as a result of increased adiposity. It is a vicious cycle because low testosterone can lead to increased adiposity, decreased muscle mass, and the cycle unfortunately tends to repeat and get worse as comorbidities start, for example, diabetes or sleep apnea. Changing your body composition with weight loss, increasing your muscle mass, decreasing your fat mass or adipocyte cells can be helpful in increasing the testosterone. This has been well known in bariatric surgery cases. Following bariatric surgery, we see testosterone levels go up. So can my GLP-1 medication, if it is causing weight loss, affect my testosterone and estrogen hormones in a man? Absolutely.